all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Good evening. We are back with yet another episode of BMC Global Live, Alhilal Health World, nothing but lifestyle. I am Jessila Mujib. Frozen shoulder is a condition that limits the movement of our shoulders. It is characterized by severe pain and stiffness. Over time, it becomes very hard to move the shoulder. To speak about this subject in detail, we have with us Dr. Matthew Philip from Alhilal Hospital, Sitra. He is an orthopedic surgeon with an experience of more than 15 years, and his area of expertise include general orthopedics and trauma management. So, doctor, welcome to the show, and thank you for joining.
It's good to be back.
Thank you for joining us today to discuss this very relevant topic, frozen shoulder.
Yes, it is a very common condition which affects a lot of people, especially people above the age of 40 to 50. And it's a very annoying condition, very painful, and often impairs the function of the person affected by it. So indeed, lot of people have concerns about it, and main thing is that it is a long-term condition. It takes some time to develop as a problem and also to resolve as a problem. It takes a lot of time. So a lot of people are concerned and bothered by this. And of course, many questions will be there. Okay. So we will start discussing about
it. Okay, doctor. Doctor, what is actually frozen shoulder, and how often you come across this condition in your OP nowadays?
Frozen shoulder is an inflammatory condition. It's a painful condition affecting the shoulder joint. It is also known as adhesive capsulitis and or periarthritis. Your doctor might call it by these other names also, adhesive capsulitis or periarthritis. But the common name it goes by is frozen shoulder. So as I said, it is a condition which affects the shoulder joint, especially the capsule and the soft tissues which surround the joint, and not per se problem within the joint or the bones which form the joint articulations, but the surrounding soft tissue is mainly affected by inflammatory process, contractures and shrinking of that those tissues. So this leads to pain, and most along with pain also the restriction of movement. So these are the two characteristics of this condition, pain and restriction of movement, and it develops over a period of time. It's a very common condition, and a lot of people, I think every day 4 or 5 people will with this condition come for their visit with this problem.
So apart from the pain, what are the other symptoms of this condition?
Yeah, pain, stiffness and difficulty in doing certain tasks like which involve taking your hand behind your back or overhead activities are mainly affected. So if you ask for the cause of this disease, why frozen shoulder, we are actually not sure why it happens. It just happens in people above a certain age usually. And also it is very common in people with other conditions, especially diabetes mellitus and disorders of the thyroid gland. It can be hypothyroidism or sometimes even in hyperthyroidism where the thyroid gland is more active also. This can, it is very common. Other conditions in which frozen shoulder may occur is you sustain an injury to your wrist or hand, and you are unable to move your hand for some time. This will lead to stiffness of the shoulder, which may later progress to frank frozen shoulder like picture. So these are the usual things which lead to frozen shoulder. Also stressful means lifestyle and also lack of sleep are also considered as predisposing factors for development of frozen shoulder.
Okay, doctor, then how can we diagnose frozen shoulder? What are the tests to be done?
Okay. Diagnosis of frozen shoulder is mainly clinical. Based on your history, the development of the symptoms, the doctor will talk to you, understand how long since you are having this problem and the existence of these associated conditions, especially diabetes and thyroid disorders, whether the lifestyle, whether there is smoking, lot of stress in the lifestyle, all these things. Doctor will clinically ask questions and get the history of the patient. Also by examination, there will be tenderness all around the shoulder and certain movements of the shoulder, especially the abduction of the shoulder, that moving the shoulder away from the body, and also the rotatory movements of the shoulder. These are the ones which are primarily restricted, especially the rotations. Investigation wise, we can go with X-rays. Most of the X-rays will be normal. The main purpose of doing an X-ray is to rule out any other dangerous condition which can affect the shoulder, or if there is any bony changes like arthritis or any. So X-ray also forms part of the diagnostic process. Other tests which we can do are the MRI scan of the shoulder, which can show this capsular contracture or maybe some joint effusion into the joint, especially the contracture of the inferior capsule. The capsule is the covering of the shoulder joint, and in many cases there is a contracture or a shrinkage of the inferior part of the capsule, which can point to that this is a process of frozen shoulder which is happening. So these are the common diagnostic tests and how this is diagnosed. So, but mainly we can understand just by talking to the patient and examining his shoulder properly, we can come to a clear diagnosis of this problem.
Okay, by physical examination?
By physical examination and history mainly.
Okay. Doctor, around what age you find this condition in people?
Yeah, as I told earlier, it is a disease of the middle ages, especially after 50 years, 40 to 50 years. And it can happen earlier if you are having these other conditions which I have mentioned. So this is the usual age group. So after the diagnosis, shall we move to the management part?
Yes.
So when a patient comes after careful examination, we have decided this is a frozen shoulder. We have to evaluate for other conditions.
Yeah.
Sometimes people who come with frozen shoulder, they might not have any history of diabetes. But many people, as I have seen, that we diagnose diabetes for the first time in such people.
Okay.
So we have to rule out whether they have, or check their thyroid gland status, metabolic status, including vitamin D levels have to be measured, just to rule out they have no other problem. If these pre-existing conditions are there, we have to correct those also before moving into the treatment of the frozen shoulder. Treatment of frozen shoulder, mainstay of treatment, I would say it will be physical therapy or physiotherapy.
Okay.
That is going to be the mainstay. Frozen shoulder occurs in 3 stages. The initial stage, it will be the painful stage. The painful stage, the patient will have pain and pain on moving the shoulder. And the second stage is where the stiffness mainly develops. That time the pain will reduce, but the shoulder will become stiff and the movements are restricted, and patient will have a lot of functional disability at this stage. The third stage lasts for more, after 5 months, almost after 5 months the pain begins, to almost 2 years it can extend. During this time the shoulder will slowly loosen up, the pain will also reduce, but in between there will be phases of sometimes it begins in one shoulder and it can after some time the other shoulder also can start to get affected. This is so physical therapy, as I said, physical therapy is one of the mainstay of treatment. We go with physical exercises first and some modalities to reduce the pain. Other ways of reducing pain are using anti-inflammatory medicines. Especially we can use corticosteroid injections directly into the affected tissue to reduce the inflammation. And combined with physical therapy, this will often give very good results. Then for some very severe cases, we may have to resort to surgical management. The current surgical treatment is use an arthroscope or a camera we put into the joint, and we release the capsule all around the joint. So that is the procedure which we usually do. But it's indicated only in very few cases, very severe cases, and where patient is in need for a quick relief. So even after that, physical therapy is very important, even after a surgical treatment.
How long we have to go for a physical therapy?
It depends. Usually, as I told you, it takes some time for the condition to resolve. So I would say about 2 to 3 months. It depends on each individual case. But you can expect a prolonged period of treatment for this.
Another common question is it preventable?
Yes, to some certain degree, even though some things like age and development of diabetes we can control with some lifestyle changes. Always staying active is one thing. We should always keep, especially the upper body movements. We should loosen up your shoulders, upper body stretches, shoulder rolls, and arm rotations. Regularly doing such exercises and staying active is very important to prevent this condition. It's and also reduce the stress, and smoking also can affect the soft tissues around the joints. So avoidance of smoking is also another important thing, and adequate nutrition to avoid any vitamin deficiencies.
So is sedentary life a reason for this?
Yes, definitely. As I told, because of its association with conditions, say somebody injures his arm and he is unable to move the hand, that person is likely to develop frozen shoulder. So therefore, we can also assume that sedentary lifestyle where your shoulder is not moved too much, you are sitting in one place for a long time, can also affect the movements of the shoulder, the soft tissue around it. Can also affect the soft tissue around it and lead to frozen shoulder.
Okay.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
So, doctor, how long does it take to recover from frozen shoulder?
Given without any treatment also people may recover from frozen shoulder, but it will take, as I told before, even years. It can take 2 to 3 years, or even some cases up to 5 years they will have this pain. But with adequate examination, treatment and physical therapy, we can shorten this period, and within a course of few months patient will be back and functional, and they can lead a fruitful life provided good treatment is given.
And once treated, is there a chance for it to come back again
Yes,
as age proceeds?
Yes, that is a good a reasonable concern of patient. But what we see usually is once it occurs in one shoulder, it rarely comes back on that shoulder. But as I told before, the other shoulder can be affected during the course of treatment, or when one is affected, very rarely both shoulders can also be affected. Then depending on some condition like people with diabetes and all, such patient we can face a recurrence of frozen shoulder. But usually once you recover from frozen shoulder, I think it doesn't recover in that shoulder.
Okay. Now you mentioned about some of the exercises. Can you please explain more in detail about the exercises?
Yeah, exercises mainly to stretch the capsules of the shoulder joint, gradually stretch the capsules of the shoulder, and also to include all range of motions. So one exercise is the shoulder rolls, where I can demonstrate now. Like you can roll the shoulder. So then the arm rotations. You hang your arm freely and rotate in circle. We call it arm circle exercises. You can do in different directions.
Both the directions. Okay.
Then the abduction exercises, where you use support of the wall to you lift the arm above the head level. And in physical therapy, we use we use other equipment also to enhance these movements, to give more range of motion, and also home exercises initially and in between the periods of physiotherapy, these common exercises. But in physical therapy, we use special equipment like pulleys, wheels, to enhance these movements and to give support to we can control the motion. So physical therapy will give a more controlled result than plain home exercises. But for preventive purposes, the other exercises, it's very easy to perform at home.
Now, can you suggest some lifestyle changes to manage this
No,
frozen
as
shoulder?
I told, to stay active, daily stretching exercises is very good for this condition. Avoidance of smoking, adequate nutrition, and these are the very common things that we can do to prevent development of frozen shoulder.
Okay.
And especially if you are a diabetic or have any endocrine problems, you correct those problems. You have to maintain a good lifestyle for those problems and also do the correct treatment for those problems.
Okay, doctor. Now, what is your takeaway message for our viewers?
Takeaway message, as I usually say, even in the most of the conditions which affect our bones and joints and muscles are mainly due to our lifestyle, especially a sedentary lifestyle. So, being active is one of the ways of, and also to avoid smoking, maintain a good posture, have adequate nutrition. So, these are the usual thing, and even though I don't recommend these as treatments, but as a preventive measure and to prevent lot of conditions, these are the things that we can do very easily. But one thing we should always keep in mind is once you develop symptoms, don't keep on doing that. I can control this at home, or exercises or some diet is going to cure. Once you face with a problem, you have to get it evaluated. You have to rule out dangerous conditions. You have to rule out any associated conditions, just like I told, whether you have diabetes. So it can happen with even if you maintain some things can happen. So the best option is to be aware of these things and seek treatment or seek evaluation. Get yourself examined. Make sure that there is no problem. If there is a problem, if you catch it in the early stage, most of these problems can be managed without affecting the function or leading to loss of time on our part. So everybody can easily get themselves evaluated at any of our Alhilal clinics. We have 8 branches all over Bahrain. It's almost just a walk away for most of us in Bahrain. So don't ignore your symptoms. You have to come for evaluation. Get yourself evaluated, get the right advice, and follow the right treatment protocol. And this will lead to good results.
So, thank you, doctor. Thank you for being with us and giving us a lot of information about frozen shoulder, which is very common these days.
Yes. Thank you, Jasila, for this opportunity. I hope I have been able to cover most of the common questions which can arise about frozen shoulder.
Yes, thank you.
I hope this episode will be useful to a lot of people. Thank you for this opportunity.
It's a pleasure. So, viewers, if you have this condition of frozen shoulder, don't panic. Seek medical attention on time and follow the doctor's advice. As doctor rightly said, follow a healthy lifestyle. Till we meet again next time, this is Jasila Mujib signing off. Good night.